Hey everyone, welcome to today's Explainer. If you care for kids, there are just some medical words that completely strike absolute fear into your heart, right? Well, today we are tackling one of the most common, yet honestly most misunderstood childhood respiratory illnesses out there. We're going to break down exactly what's happening inside your child's chest, clear up some massive, widespread misconceptions, and hopefully give you the confidence to handle it like an absolute pro.
Just hearing the words, "your child has bronchitis," is enough to send almost any parent into an absolute tailspin. Almost every parent has heard this terrifying phrase at some point. And for so many families, those four little words immediately trigger pure panic. It conjures up visions of nebulizers, strong medications, desperate steam inhalations, intense chest rubs, endless sleepless nights, and just this overriding, terrifying fear that things are about to get drastically worse. It is a really scary diagnosis to hear.
Okay, take a deep breath, because here is the immediate, shocking truth that we are going to unpack today. Most childhood bronchitis is simply not dangerous. I know, sounds crazy, but it's true. And even more surprising, most of these cases do not even need antibiotics. In fact, many parents accidentally make the situation worse while genuinely, desperately trying to help. So we are going to take you on a journey today from that initial panic to complete empowerment.
To get why it's not usually a huge deal, we kind of need to look at the plumbing, the anatomy, right? Bronchitis literally just means inflammation of the bronchi. Picture an upside-down tree sitting right inside the chest. The trunk of that tree is the trachea. Then that trunk splits into branches. Those branches are the bronchi. They're the airways that carry air deep into the lungs. When viruses, bacteria, allergens, smoke, or honestly, even just really dry air affect those airways, the delicate lining becomes inflamed.
When that inflammation kicks in, your child's body basically throws a three-part tantrum all at the exact same time. First up, we get swelling, which physically causes the airway to become narrower. Second, mucus production ramps way up as the body tries to trap and wash away the irritation. And let's be honest, kids can produce an unbelievable, almost magical amount of mucus. And third, we get an airway spasm. The muscles wrapped around the bronchi tighten up, making it way harder to breathe. Swelling, mucus, and spasm. That specific triple threat combination is exactly what creates the scaring coughing, the wheezing, the noisy breathing, and that heavy chest congestion you hear rattling around in your child.
So here is the absolute crucial takeaway. In kids, acute bronchitis is viral almost all the time, like practically always. A virus enters through the nose or throat. Sometimes it just stays up there and causes your basic run-of-the-mill cold. Sometimes it moves down and affects the voice box. And sometimes, depending on the specific virus we're talking about, it reaches those bronchi branches. But because the culprit is almost always a virus, throwing antibiotics at it usually does absolutely nothing.
Now, before we go any further, I really want to absolve you of some major parent guilt here. Despite what your mother-in-law might confidently tell you, bronchitis does not happen because your child walked around barefoot on the tile. It doesn't happen because they drank cold milk from the fridge, and it certainly doesn't happen just because they went outside in the winter without a heavy coat. Viruses spread from person to person through the air, period. Whether bronchitis develops depends mostly on which specific virus your child happens to encounter, not on any of these supposed parenting mistakes.
Okay, let's dive into this. If it's just a virus, and it's definitely not a parenting mistake, why on earth does that terrifying, hacking cough hang around for weeks on end? Let's take a look at the actual mechanics of that cough, because frankly, this is where the real battle is fought in your home.
Well, here's the real climax of today's explainer. The actual villain here isn't the cough. It's thick, dry mucus. When a kid gets a stuffy nose from a virus, what do? They naturally start breathing through their mouth. When they mouth breathe, the airways dry out. And when the airways dry out, the mucus inside those bronchi becomes incredibly thick and sticky.
If that mucus dries out down inside the lungs, it basically acts like a plug. Ventilation becomes blocked, and that is exactly how serious complications like pneumonia can actually begin to set in. So your true objective as a parent completely changes. The real goal is not stopping the cough. The goal is preventing the mucus from drying out in the first place. You literally have to keep the mucus well.
We really need to totally reframe how we view the cough itself. Think about it this way. Coughing is how the lungs clean themselves. The cough is not the enemy here, it is a highly productive, absolutely crucial mechanism. The body is actively trying to push that sticky mucus out of the airways naturally. Suppressing every single cough with over-the-counter syrups is not always a good idea, because a productive cough is a clear sign the body is actually doing its job.
Now you're probably wondering, wait,
If it's viral and we just need to manage mucus, why do so many of us leave the pediatrician's office clutching a prescription for antibiotics after hearing the word bronchitis? It's a great question, and honestly, the answer is a bit uncomfortable. Doctors are often trying to protect themselves because, well, parents are terrified. We're terrified of pneumonia, terrified of complications, and frankly terrified that nothing is being done. So antibiotics get prescribed just in case. But listen, unnecessary antibiotics do not prevent viral complications. Instead, their overuse creates resistant bacteria, unwanted side effects, allergic reactions, and totally false expectations for the next time the kid gets sick.
And it's not just the meds. In our pure desperation to just do something, we tend to throw everything at it, right? We turn to traditional remedies. Very hot steam inhalation, cranking the heat to overheat the child's room, heavy chest rubbing, and forcing constant warming treatments. But get this, these actually increase the risk. Why? Because they worsen dehydration. Remember, dry mucus is the primary problem, and anything that overheats or dries the child out can make things significantly worse. In fact, hot steam is actually pretty dangerous for children, unless it's specifically recommended and monitored by a doctor.
So, what actually works? Well, the most effective treatment for viral bronchitis is actually surprisingly, maybe even frustratingly, simple. You need cool air, humid air, plenty of fluids, good ventilation, and movement. That's pretty much it. While we parents are constantly searching for strong medicine, these basic home care tools matter far more. A child with bronchitis should be drinking a ton. The room should have fresh air, and definitely should not be hot and dry. Your job is simply helping the mucus stay wet enough to come out on its own.
Let's actually look at a physical technique you can use at home to help clear that stuck mucus naturally. It's called postural drainage. First, you just lay the child down so their hips are slightly higher than their head. Then, you gently tap their back with your fingertips. This simple combination of gravity and vibration can really help loosen mucus stuck inside the airways. However, a really strong word of caution here. This should absolutely only be done when the child is generally stable and does not have a high fever.
Now, even with these great tools in your back pocket, it is completely 100% natural as a parent to ask, okay, but how do I know if this is actually dangerous? At what point does this cross the line from a manageable everyday virus to a true medical emergency? Let's transition over to the red flags so you can identify real medical distress.
Let's compare the two main scenarios side by side. A kid with viral bronchitis, they're usually still drinking, moving around, reacting to you, and they usually have standard cold symptoms, like a runny nose. But a bacterial infection? That presents very differently. The child will look seriously ill. They will be weak, pale, and lethargic. Their energy completely disappears. Breathing becomes visibly difficult, like you can see them struggling. And interestingly, their nose is often completely dry. So, here is an incredibly important, actionable little formula for you to memorize. Cough plus a runny nose, that almost always equals a manageable virus. But a severe cough plus a dry nose plus obvious breathing distress, that equals the need for an urgent medical evaluation. If you see that second combination, drop what you're doing. It's time to get to a doctor immediately. At the end of the day, most bronchitis in kids is absolutely not a medical disaster. It is simply a respiratory virus combined with the need for some really good mucus management. Modern medicine sometimes makes everything sound overly complicated, which just leaves parents feeling totally powerless. But preventing severe complications is really based on fresh air, fluids, humidity, and patience. Ultimately, a calm, informed parent is quite literally one of the best treatments a child can possibly have.
We've really seen how understanding the actual mechanics of an illness totally shifts our whole approach, right? From pure panic to practical, confident care. But it does leave us with a fascinating final thought. If simple cool air, extra fluids, and patience can effectively outsmart something as terrifying sounding as childhood bronchitis, what other common childhood illnesses are we currently overtreating out of pure fear? Definitely keep that in mind next time your little one gets the sniffles. Thanks for joining me on this Explainer Focused Learners, and I'll catch you next time.